What if you found out that nitrous oxide, a common anesthetic, isn't necessary for successful emergence? Quite a revelation, isn't it? For those unacquainted, nitrous oxide, often referred to as laughing gas, is a staple in the world of healthcare. It's been used for decades to help patients manage pain and anxiety, particularly in dental procedures and during labor. But it's also a key player in the theater of surgical anesthesia, where it's used to induce a state of unconsciousness, allowing surgeons to operate without causing discomfort or distress. Despite its widespread use, nitrous oxide is not without its issues. It's a potent greenhouse gas with a warming potential over 200 times greater than carbon dioxide. Moreover, it's contraindicated in a number of situations. For instance, it's not recommended for patients with bowel obstructions, pneumothorax, or certain types of eye surgery, due to its potential to expand gas-filled spaces in the body. Furthermore, nitrous oxide has a number of potential side effects. Some patients may experience nausea or vomiting, while others might suffer from headaches or dizziness. In rare cases, excessive use can lead to a vitamin B12 deficiency, leading to neurological issues. But what if we could eliminate these risks? What if we could perform emergence, the process of bringing a patient out of anesthesia, without the use of nitrous oxide? Recent studies suggest that this might not only be possible, but also beneficial. The use of alternative anesthetics, such as propofol or sevoflurane, may offer a safer and more controlled emergence with fewer side effects. Furthermore, these alternatives don't carry the same environmental impact as nitrous oxide, making them a more sustainable choice. So, it's time to question the old ways and embrace the new. It's time to reconsider our reliance on nitrous oxide and explore the potential of nitrous oxide-free emergence. It seems that nitrous oxide isn't as indispensable as we once thought. It's an exciting time in the world of anesthesia, and we're eager to see what the future holds. Before delving into the main topic, it is essential to understand what emergence means in the context of anesthesia. Emergence, in the realm of anesthesia, refers to the process of transitioning from an anesthetized state, where the patient is unconscious or sedated, back to their normal conscious state. This is a phase of the anesthetic procedure that is just as vital as the induction and maintenance of anesthesia itself. Picture this: a patient is wheeled into an operating room for a surgical procedure. An anesthesiologist administers a carefully calculated dose of anesthetic agents, effectively inducing a state of unconsciousness. The surgery proceeds smoothly, and once completed, the patient must then be brought back to consciousness, a process known as emergence. Emergence is not merely about waking up. It is a complex and delicate process that requires a careful balance. Too swift, and the patient may experience undue distress or discomfort. Too slow, and there may be concerns about prolonged sedation or potential complications. During emergence, the anesthesiologist gradually reduces the administration of anesthetic agents, allowing the body's natural metabolic and excretory systems to eliminate these substances. As this happens, the patient's consciousness slowly returns. They may first respond to verbal commands, then gradually regain motor control and eventually full awareness. It's important to remember that emergence is not a one-size-fits-all process. Various factors can influence it, such as the type and duration of the surgery, the patient's health status, and the anesthetic agents used. For instance, a patient undergoing a short, minimally invasive procedure may emerge from anesthesia relatively quickly, while one who has had a more complex or lengthy operation may take longer to regain consciousness. In the context of our discussion, we're particularly interested in the role of nitrous oxide, a commonly used anesthetic agent, in the process of emergence. It's a question that's been stirring in the medical community. Can the process of emergence occur without the use of nitrous oxide? Emergence without nitrous oxide, a seemingly impossible task, is not only possible but also advantageous. You might be wondering, how can this be? Well, buckle up, because we're about to delve into the nitty-gritty of anesthesia without the laughing gas. The process of emergence or recovery from anesthesia typically involves nitrous oxide, fondly known as the laughing gas. However, recent advancements in anesthetic techniques and drugs have made it possible to navigate this process without the use of nitrous oxide. For instance, consider the use of propofol, a drug frequently used in induction and maintenance of anesthesia. Propofol has been shown to facilitate a smoother, quicker recovery. Patients emerge from anesthesia with less nausea and vomiting, a common side effect linked to nitrous oxide use. Moreover, the use of other anesthetic agents like sevoflurane and desflurane, which have less solubility in blood, allows for rapid elimination from the body. This means a faster and more controlled emergence process, reducing the risks associated with delayed recovery or post-operative cognitive dysfunction. But don't just take our word for it. Let's look at some real-world examples. A study published in the British Journal of Anesthesia showed that when nitrous oxide was omitted from anesthesia, patients experienced less post-operative nausea and vomiting. Another study in the Journal of Clinical Anesthesia found that patients who underwent surgery without nitrous oxide had a faster recovery time and fewer instances of post-operative delirium. These studies, among others, are beginning to paint a clear picture. Emergence without nitrous oxide isn't just a possibility, it's a beneficial choice. It allows patients to recover more quickly, with fewer side effects, ultimately improving their post-operative experience. In conclusion, the science and practice of anesthesia is constantly evolving. As we challenge traditional methods and explore new techniques, we're finding ways to make the process safer and more comfortable for patients. As we can see, nitrous oxide-free emergence isn't just a theory but a reality. Let's dive deeper into the benefits of nitrous oxide-free emergence. One of the most compelling advantages of this method is the potential for faster recovery times. Nitrous oxide has a slower elimination rate from the body compared to other anesthetic gases, which can lead to prolonged recovery periods. Without the presence of nitrous oxide in the system, patients can often regain consciousness more quickly following a procedure, leading to shorter stays in the recovery room. Another significant benefit is fewer side effects. Nitrous oxide is known to cause a range of side effects, including nausea, vomiting, and a sense of disorientation. By eliminating this gas from the anesthetic regimen, we can significantly reduce these unpleasant post-operative experiences. This not only improves patient comfort but also reduces the workload for healthcare professionals, making it a beneficial choice all around. Now let's not forget about the environmental impact. Nitrous oxide is a potent greenhouse gas with a warming potential over 200 times greater than that of carbon dioxide. By opting for nitrous oxide-free emergence, we can significantly reduce the environmental footprint of anesthesia. This is an important consideration as we strive to make healthcare more sustainable and environmentally friendly. Furthermore, nitrous oxide-free emergence can also lead to cost savings. Shorter recovery times mean less time spent in the hospital, leading to reduced healthcare costs. Fewer side effects mean less need for additional medication and treatment, again, saving costs. These savings can then be passed on to patients, making healthcare more affordable. To sum it up, nitrous oxide-free emergence offers a multitude of benefits. It provides faster recovery times, fewer side effects, and less environmental impact. And it can also lead to significant cost savings. In a world where we're constantly looking for ways to improve patient care while also being mindful of our environmental responsibilities, this method of emergence shows great promise. Emergence without nitrous oxide appears to be a win-win situation for both patients and the environment. With these facts in mind, what does the future of anesthesia look like? As we ponder this question, let's consider the potential shifts in anesthesia practices in light of the possible emergence of nitrous oxide-free procedures. First, let's think about the implications for healthcare professionals. Anesthesia providers might need to update their knowledge and skills to adapt to the new methods. This could involve additional training or continuing education, as the nitrous oxide-free techniques might require a different set of skills or a deeper understanding of the patient's physiological responses to anesthesia. Moreover, there could be changes in the way operating rooms are set up and function. The absence of nitrous oxide might necessitate modifications in the anesthesia delivery systems. Hospitals and clinics may need to invest in new equipment or modify existing ones to support these changes. Now let's turn our attention to the patients. Nitrous oxide-free emergence could potentially lead to a smoother recovery process. With the elimination of the side effects associated with nitrous oxide, patients might experience less nausea, vomiting, and dizziness after surgery. This could translate into shorter recovery times and possibly a more comfortable post-operative experience. Furthermore, the shift towards nitrous oxide-free anesthesia could have environmental implications. Nitrous oxide is a potent greenhouse gas, and its use in medical settings contributes to its atmospheric levels. By eliminating its use in anesthesia, we could be taking a significant step towards reducing our carbon footprint. However, it's important to note that these possibilities are based on current research and understanding. As with any medical advancement, further studies and clinical trials are needed to fully understand the benefits and potential drawbacks of nitrous oxide-free anesthesia. The future of anesthesia could very well be nitrous oxide-free, And together we are on the forefront of this medical revolution. As we continue to explore and innovate, we are not just changing the face of anesthesia, but potentially transforming the patient experience and contributing to a healthier planet.